A new cluster has been detected as Malaysia reported 21 new COVID-19 cases, bringing the total number of infections in the country to 8,800. Health Director General Datuk Dr. Noor Hisham Abdullah said the first case from the Kluang Old Folks Home cluster in Kluang, Johor was detected after a death which was recorded as the 123rd death from COVID-19 in the country on Sunday. 39 individuals have been screened for the coronavirus from the cluster, with 14 found positive, 18 negative, and 7 still waiting for their test results. The Health DG said 13 of those tested positive for COVID-19 were Malaysians and the other was an Indonesian national. He said 11 of those found positive for COVID-19 were residents of the Old Folks Home, while one was a family member and another a worker. Dr. Noor Hisham said steps had been taken for containment and infection control at the site. The death that was recorded on Sunday involved a 72-year-old man with a history of chronic high blood pressure and stroke. The patient was referred to hospital in Jet Besar Haja Kausum in Kluang on Friday and died the same day. He was tested positive for COVID-19 2 days later. Meanwhile, 6 of the 21 new cases in the country were imported, involving 4 Malaysians and 2 non-Malaysians. The imported cases involved 3 individuals returning from the Philippines and 3 individuals returning from India, Russia and Denmark, respectively. Of the 15 locally transmitted cases, 13 involved Malaysians and 2 involved non-Malaysians. The Health Director General said of the 13 locally transmitted cases, 12 were from the Kluang Old Folks Home cluster, while 1 was detected during a pre-operation screening in Negeri Sembilan and was admitted to the Tuanku Jaafar Hospital in Seremban. Of the 2 locally transmitted cases involving non-Malaysians, 1 was detected during a pre-operation screening and another came from the Kluang Old Folks Home cluster. Dr. Noor Hisham said 2 patients had recovered and were discharged, taking the total cumulative discharge cases to 8,555. 3 were being treated at the intensive care unit, with 1 of them on ventilator support. No death was recorded. The death toll remained at 123 cases.